My name is Michelle Leginsky. I will be doing an assessment of the ears, nose, throat, and mouth.
My name is Dalia Leginsky, and I consent to this assessment being recorded.
All right, so we're going to start with an assessment of the ears. This is going to be an assessment without an otoscope. If I had access to an otoscope, I would be examining the inner ear and the eardrum for any signs of infection. So the beginning of the assessment begins with an inspection. I'm looking for symmetry of the ear, looking at the external ear for any lesions, any redness, any drainage, or any discharge in the ear. All looks to be intact. Do you have any dizziness?
No.
Do you have any difficulty hearing?
No.
Any drainage from the ear, or that might be clear in color, or any bloody drainage from the ear?
No.
All right, we're just going to do a brief test for your hearing. I'm going to cover your ear and I'm going to whisper 3 words and you're going to repeat them for me.
Apple, baseball, cake.
Very good.
Dog, elephant, fire.
Okay, all seems to be intact. No trauma to the head or any injury to the ear that you remember. Okay, now we're going to move down to the nose. I'm going to take my pen light. I'm looking up for symmetry of the nose and the nostrils. I'm also going to look inside for any deviation of the septum. All seems to be intact. I'm looking for the color. No noticeable sores. Do you have any difficulty with smell?
No.
Okay. I'm also going to palpate the area where your sinuses are. Any pain or pressure?
No.
And how about up here?
No.
All right. Do you have a history of nosebleeds?
No.
Okay. So now we're going to move down to the mouth and throat area. So my first step is to look at the assessment inspection of her lips, looking at color and dryness. Color seems to be normal and intact. Your lips appear to be a little bit dry and cracked. Do you drink enough water during the day?
Mm-hmm.
Are you on any medication that may cause dryness to the skin?
Yes.
And what is that medication?
That is medication for acne.
Okay, so a common side effect of the medication to the dryness of the skin, is definitely explainable and might be the reason. So it would probably be a good idea when you're noticing an abnormality in the assessment to ask for a list of medications if you don't already know them. Okay, so now we are going to open up. I'm going to use my light. Stick your tongue out and say ah. Very good. I'm looking at the tonsils to make sure that they are not red inflamed or have any white patches, which would be a sign of an infection. Do you have any pain swallowing?
No.
And I would be feeling here for any lumps, any swelling. Nope. Can you do me a favor, stick your tongue out and move it side to side? Good. Very good. While I'm in there, I was also looking for any sores or lesions noted in the mouth, looking at the color of the buccal mucosa, which is the inner lining of the mouth, which all seems to be intact, pinkish in color, not red, no signs of any sores or lesions. I'm going to just take another look inside your mouth at your gums and your teeth. Very good. Any bleeding of the gums?
Mm-mm.
Any changes to the throat, post-nasal drip, hoarseness like that?
No.
Okay. Any issues with allergies?
No.
Okay. That is a very brief, basic assessment of the ears, nose, and throat. Thank you.